Good day, my dear undergraduate exam going students. And I am going to take a class for you which may not be covering or crossing 3 to 5 minutes. The topics are given in the enclosure. And these are my references. You people should have your book open. That is why it is called Open Book Rapid Revision. Please have your books open, and when I mention a particular topic, see whether you are able to follow it. This is one. For example, in the chapter on wound healing, see the different types of cells: labile cells, stable cells, permanent cells. The words are important. Find out, read up what they are. I am not going to teach you again. And only then we can go to healing. And what is the definite difference between the primary healing and the secondary healing? So I would like you people to kindly find out what is primary healing. This is a university question repeatedly asked. There will be a line diagram. You people are supposed to follow the line diagram. What are the classical examples of it? Also, what are the stages of wound healing? There will be beautiful line diagrams in every book, including my tips and my R.A.T.S class. Please go through it and you will have to draw the diagram. Without diagram, you lose 30% of your marks. Straight. Regarding the stages, please find out whether there is something called as neovascularization, then the breach in the basement membrane, formation of a hematoma, and then the proliferation of the fibroblast, granulation tissue, etc. All these components you will have to include. The days, exact time by time, it is not necessary, but if you write, it is an advantage. But find out. But the terms you people will have to write: neovascularization, hematoma formation, granulation tissue, fibroblast, inflammatory cells. And ultimately, you find that there will be one residual scar in a case of primary healing. The same thing is almost applicable to secondary healing, but the problem is it happens in large wounds such as ulcers, where the edges will not be opposed. Here again, there will be a line diagram. Kindly draw the line diagram, and there will be some kind of proliferation, but ultimately, instead of one line, you will be finding a broad band of connective tissue or a scar. This you people will have to draw and mention. What are the examples and what are the causes for secondary healing? Factors affecting wound healing. This is asked in the Viva, this is asked in the essay question or a short note every time. And you people will have to divide it into primary healing, secondary, and local factors, general factors. The local factors will be about the blood supply in the region and other things. General factors, whether patient is anemic, age of the patient, etc. These two things, the moment they ask you the question, general factors, local factors. For example, vitamin K, vitamin C, all these are important. You people will have to mention the factors. Moreover, if you are interested, go to my chapter on tips. A to Z, I would have given you a mnemonic. A to Z. What are the factors affecting wound healing? Please try to by heart. At least 10 you will be able to reproduce very easily. The complications of wound healing. Again, I have given it very elaborately in my book, the tips, as well as in my class. R.A.T.S class is the best one for you people to go to it, and you will be finding there can be infections, wound adhesions, there can be a scar formation, there can be a keloid. Keloid can come as a question itself. So when you people Answer all this elaborately to get the marks. There can be herniation. So I would like you people to mention the complications. So what is the definition of a wound? What is primary healing? What is secondary healing? What are the factors affecting wound healing and the complications of wound healing? And go to my R.A.T.S class, you will find A to Z factors that affect wound healing. And the cells, stable cells, labile cells, permanent cells for introduction. This all of you know, the fracture healing. But then how to write it, I have again described it. You are supposed to draw a line diagram, something like what is on the screen, and what are all the various stages. For example, there is initially a hematoma formation, and then there will be the proliferation of the various ones. There will be again neovascularization, proliferation of the bony trabeculae, and they will be fusing together to form the callus. So this one you people will have to do. It is initially broader and then it undergoes a remodeling. It becomes almost like the original bone. All the stages you'll have to mention. The procallus formation, what is the callus formation? Prior to that, what is the hematoma that is being formed? What is the remodeling, etc. The stages must. It takes about a month for healing, and line diagram is a must. And whenever you people are asked the definition of a fracture, it is a break in the bone. And what are the factors affecting the fracture healing? I would have mentioned 6 I's or 7 I's. Letter I: infection, interposition of soft tissue, improper immobilization, increased distance between the fragments, inadequate blood supply. So I would like you people to kindly go through all these things and the complications of fracture healing. It can be non-union, malunion, myositis ossificans, etc. So kindly go through this one. Fracture healing, it is an unexpected question, but in one instance, my students wrote better than the classical university or the government students. So in that way, I am very happy. You people will have to read all this. These are the references. As I told you, open book system. Open your book, follow what I say, mark it by heart. Thank you.